Let's first define what exactly insomnia is. All right. So according to the American Academy of Sleep Medicine, it is comprised of four parts: a difficulty falling asleep, staying asleep, or having sleep that's not really restorative, so you wake up not refreshed, okay? The difficulty is present despite the fact that you have the opportunity to sleep. So in other words, you're in bed and you have the opportunity to sleep, you're not sleeping appropriately. The impairment is associated with distress during the day. So just sleepiness, or maybe you feel like you're not working your best during the day or during work. And it occurs at least 3 times a week, or has been a problem for at least a month. And that's a typical definition of significant insomnia, right? It is the most common sleep disorder. Apparently affects 1 in 4 individuals in the United States. And it seems to correlate with cardiovascular disease, anxiety, cancer, and even overall mortality. And one thing that is an issue is the conventional sleep aids, the hypnotic sleep aids, the benzos, and the non-benzos actually kind of work on similar receptors. Things like zolpidem or Lunesta, they actually are associated with increased mortality. As we mentioned, a lot of people have insomnia, but also a significant amount of the US uses sleep aids, right? 10%. So what are the types of insomnia? So here are some general categories. There are others, but here are the ones that seem to be the most common. So transient insomnia, which is the most mild, it's just for a few days. And many times this might be linked to just acute events. So maybe construction outside or changes in the weather, or something like jet lag would be a good cause of transient insomnia. And it goes away within a week. So it's really not that big of a deal. Acute insomnia, usually this is linked to changes in emotional state. So maybe the death of a relative, or the end of a relationship, or, just things involving your family or at work that are ongoing, a difficult project. But again, it usually is self-limited and only lasts the time period of whatever that emotional event was. And then there's the insomnia that's much more severe, chronic insomnia, which lasts months to years. This is the type that we really are concerned about because it has a profound impact on morbidity and mortality. This is where you see increases in terms of heart disease, stroke, diabetes, as well as just all over death. And despite the fact that some of these may be limited in terms of the time period, all of them will increase cortisol, epinephrine, and stress hormone levels, which then in turn will increase those cytokines, which then in turn will increase inflammation. As we all know, inflammation is a bad thing because this is linked to atherosclerosis, diabetes, cancer, stroke, you name it. And then finally, another type of insomnia that's more related to pain, which we're starting to see a lot with increase in the chronic pain population, is just insomnia due to chronic pain. And you'll see this with exacerbations of certain illnesses such as osteoarthritis or fibromyalgia or low back pain. And of course, ideally, in this particular case, it's a little special because the idea would be more to eliminate the root cause, which would be the issue you're dealing with.